Hi everyone, welcome to How to Learn Medicine channel. This is Medician. In the beginning of this video, there is something I want to let you know. This video contains no good animations or colorful video editings. Instead, we tell you the truth of medicine and help you learn medicine. Let's start today's talk. What are your thoughts regarding heavy medicine textbooks? Whether you're a medical student, already attending physician, have you ever read textbooks from cover to cover? Yes, the topic today is our medical textbooks. Are you still studying hard on your textbooks? We are going to change your mind completely so that you'll start to put each one of them back to your bookshelf. Now, if you have not seen my previous video on learning precision medicine, please go and see it for two reasons. First, the truth of precision medicine is too important that you cannot miss it. Second, because the idea of reading medical textbooks and learning precision medicine, as a result, are the same. That is, please stay away from learning precision medicine and back off from reading medical textbooks. If you have already watched the previous clip, you can almost predict what I'm going to say. It is the exact same answer. What is the reason you should not read medical textbooks? Because you just can't memorize those books at all. Boom. Only makes your brain explode. Compared to precision medicine, I know all of you quite understand that you should not read textbooks. In addition, you may have been told or suggested so many times from your seniors, classmates, and even friends. However, you may still end up reading them through. Why? Because your competitors are still reading them, your professors are still using them, and most importantly, no one ever tells you what to do if you stop studying them. This is why I'm here. I will address each of the problems you have encountered and share with you how to not study from textbooks. Even if you really need to read, how to read those big thick books. This means no more markers, highlighters, and underlines for you and the textbooks. We will leave them as a clean book. Alright, before I jump into the practical tips and methods, I really want you to pay attention and think about a few following questions. Because the answers for these questions are extremely important concepts you really need to understand before learning any techniques. You can only get it right if you first get the concept correct. First, what are the purposes of those heavy textbooks? What were the author thinking when they were writing book chapters? Are the textbooks written down for you to read them through? You should have known the answers long time ago. If you do not know, it just means you probably never thought about it. Let me ask you in a different way. When is the first time you try to memorize a math or physics equation? Have you ever thought how a math or physics equation is made? Get some ideas? Here is the answer, the most important concept today. An original mathematical or physics equation is created when there are repeated but similar problems bothering the scientists, who recognize they were just using the same calculations constantly. Therefore, scientists define a mathematical or physics equation so that they could continue to use it without rethinking or redoing the whole algorithm over and over again. Got it? Medicine is no different. Here is how a medical textbook is made. Started from the beginning, there were just patients with comparable signs and symptoms. Doctor analyzed those clinical manifestations based on their characteristics with or without outside reported cases, and then coin the name and define the disease. Subsequently, these defined diseases were validated and further researches and studies for each disease continue to grow into a huge amount of knowledge database. With all that massive data, doctors and researchers have no choice but write it down into textbooks so that there is no need to remember everything, and they can look it up one day as a reference if needed. Have you ever seen anyone reading a math or physics textbook that summarizes all the equations first, before she or he ever uses those equations to solve a question or a problem? If not, why you must learn medicine in that way? Aren't you reading the textbooks before you encounter an actual disease or a case? If in the math and physics field that scientists got a problem first, followed by inventing an equation to solve it, and in the original medicine that physician defined a disease first, followed by writing down the textbooks to avoid cramming knowledge. Now you are learning medicine by reading a textbook first. Why should you do that? Why doing the reverse way? Please don't get me wrong. I do not encourage people to go meet and treat real patients and learning the medicine afterwards, because patients are not guinea pigs. But what should we do instead? Now, for a number of years, some people have recognized this problem and recommend the solution, which they call as problem-based learning. However, if you are thinking only doing problem-based learning will help you, let me ask you a quick question. You are still reading, underlining, and highlighting the textbooks, aren't you? This is why I'm here to show you the right way, and the most importantly, the success way. Again, please do not misunderstand. Medical textbooks are good stuff, but they are only good as references. Any book called a textbook simply means that it has warned you, I'm a reference, and it may not be wise to read. This is the truth. For all textbooks, do not let textbooks make your brain dead. From now on, stay away from reading them. Alright, after I finish the two important concepts and truth discussion, we'll begin to teach the actual techniques and methods to learn medicine, starting from the next video. You can subscribe to the channel if you like it, or want to get notified once the teaching videos are uploaded. Also, you can visit my blog, as the posts are usually 1 week ahead of those videos. This is the end of this video. Thank you for watching. Please let me know what you think, or if you have any additional comments or suggestions. See you.